There's a new promising treatment that can make a dramatic difference for them. A study published last week found an experimental drug helps children build up a tolerance to peanuts over time. Allergist Dr. Reena Mehta is here to explain what a breakthrough could mean. Thanks so much for joining us.
Thanks for having me.
Yeah, so it's pretty common for children to have peanut allergies, and just describe what that life is like with a kid with a peanut allergy.
Well, it's difficult. So, allergies and food allergies in general are rampant and increasing by more than 50% in the last 20 years. So peanut allergy is the most common. 1 in 50 children have an underlying peanut allergy. And a lot of times these reactions can be anaphylactic, meaning can lead to death, and really severe reactions. So a life for a child with peanut allergy can be very scary. It's difficult to go to normal places and be able to be relaxed.
And this happens within seconds,
Within
doesn't it?
seconds.
Your throat may close up, you're not able to breathe. I mean, am I?
Right, exactly. And so what this study has showed us in the New England Journal, just published last week, is that patients can now get a small dose of peanut over a period of time, almost called like a desensitization, where you gradually get increasing doses and build a tolerance to peanut protein over time, so that you don't have to worry that trace amounts of exposure to the peanut will actually lead to a life-threatening reaction.
And this is actually put into capsules, and the children would take the capsules and eventually, I guess, kind of build their endurance up over.
Exactly, that's exactly the concept. So it's peanut flour that you can pretty much buy at the grocery store, measured in careful amounts, put into a capsule, and what it is that there's teeny tiny doses that are given at the very beginning, and every couple of weeks they come back and the dose is increased.
Well, the study has shown that if they take this new medication, I shouldn't call it medication, the peanut flour, that they would be able to eat, what, 2 peanuts, 3 peanuts without a problem?
Right, so this study had over 500 kids, and by the end, 2/3 of them were able to eat more than 2 peanuts a day.
Wow.
So, I mean, these patients could have been anaphylactic with trace amounts before. Now they can eat up to 2 without having a life-threatening reaction.
And so what that means is if you're going to a party, your kid's going to a birthday party, that means they can actually have a Reese's peanut butter cup without you freaking out about it.
Right, exactly. So it causes, it relieves a lot of fear and anxiety that kids and parents have, and you can rest assured that your child will not have something terrible happen to them when your child is unsupervised.
How do they find out about how to get this new treatment?
Well, so it's up for FDA review in 2019, so hopefully in a year or 2 it will be available where allergists can provide this type of therapy.
Hope for next year.
All right. Hope for next year.
All right. Dr. Reena Mehta, thank you so much for joining us.
Thanks for having me.